Welcome back, everybody, to the show. If I'm describing you right now, like get close to the television and listen to this. Weight gain. Maybe you have brain fog, depression. You have trouble sleeping. Dr. Red's nodding because he's heard all of these symptoms before. He's a chiropractic physician. He's from Red River Health and Wellness. How many people come in and just have a list of things that they're struggling with?
Every one of our patients. I mean, we see patients from 30 different countries in the 30 different countries in the world and every state in the nation, and they are struggling with so many different symptoms, and nobody knows what in the world to do with them.
And they've been to different physicians, they've tried different things, and they're not going away. What do you look at that helps and is different?
Well, here's the biggest thing. A lot of our patients suffer with autoimmune conditions, which means their immune system is attacking some form of their body, okay? And the biggest thing there is most of these patients are just given a pill for the symptom and that's it, and nothing's being done to calm down the autoimmune response at all. And so that's where we see the biggest issues and the biggest problems of why they just get worse and worse and worse.
Are we talking about low thyroid? Are we talking about Hashimoto's?
Yeah. So low thyroid, the number one cause of low thyroid is Hashimoto's, but any form of autoimmune condition this relates to, right? So one of the biggest things that you'll see is these patients will have multiple triggers that will cause it to flare up, okay? They'll have physiological triggers, they'll have environmental triggers, they'll have dietary triggers, and it's different for each patient. It's not the same.
And you might have a combination of the three.
Yeah, for sure. And so you have to test and see exactly which trigger is causing this patient to flare up and to feel awful, and then you have to go in and improve them. So like, for example, just within the body, they might have blood sugar imbalances and cortisol defects, and they might have a couple of different environmental triggers. Then they might have a slew of dietary triggers, and you have to pinpoint exactly what's causing that patient's problems. And once you improve them, then they go from having 5 good days a month to 25 good days a month.
You and I have never talked about environmental triggers.
Tons.
I didn't know that was on the list.
Yeah. Tons of environmental triggers. It's just you have to test for it, right? And if you can avoid them or minimize exposure to those environmental triggers, it significantly improves the patient's quality of life and dampens the autoimmune response and makes a big impact.
All right, tell us about your patient, April. What was she going through?
April was struggling with tons of symptoms: depression, fatigue, weight gain. She just felt awful. She's a school principal. She's one of my favorite patients. And she went to 8 different doctors, didn't know what in the world to do. She just kept on getting worse and worse and worse. Lo and behold, she ended up having Hashimoto's disease, which is the #1 cause of low thyroid. And we went through and tested, did all the blood work to see exactly what were her triggers specifically. And then we started to work on them. She lost 65 pounds in 6 months. And she's still losing weight right now.
Look at her at the finish line.
She's running half marathons. She's she's extremely active. She feels so much better than what she did before. But it's as simple as going through and making sure we're getting to the underlying issues, and we're not just treating the symptoms, and then we're educating them and showing them what to do, what not to do, and it's allowing them to have a lot better quality of life and making a lot bigger impact.
What I love about this is there's hope. If you are dealing with all those things, if you have something that's unexplained and it just no one can explain, like no one can help you with it, come and see Dr. Red.
For sure. That's typically who we see. We see the patient that comes in that has no hope, no answers. They're so frustrated. They've been told that they're normal, and they're not normal. They feel awful, and everyone thinks they're crazy, but they're just being mismanaged. And this is why.
I can see it on April's face. That was the biggest change, don't you think?
It's like the best rewarding job.
Oh, I'm sure.
I mean, you could ever ask for.
Red River Health and Wellness, everybody. Their information is right there on your screen. Locations in South Jordan, in Logan, and St. George. Call for that free consultation. Number on the bottom. Go to abc4.com/GTU. All right, up next, Allie is in the kitchen. She's making a mochi muffin.